Hello and welcome. My name is Jane and I'm an infant massage instructor. And in this session, what I'd like to do is show you some tips and techniques to help calm, soothe and settle your baby. Now babies cry, that's just what they do. It's their way of communicating to you. They cry because they're too hot or too cold, or perhaps they're hungry or overtired. And some babies cry just because they want to be picked up and held and cuddled because they're finding their transition into this big wide world a little bit daunting. And that's all fine and normal and what you'd expect. Sometimes some babies cry over and above what would be considered the average crying time. And the reason for that could be things like wind, colic, constipation or even reflux. So what I'd like to do, first of all, is clarify some of those terms so there's a clear understanding of what each of those are. And then I'd like to go through and show you some techniques that you can use to help calm your baby. So first of all, colic. Now colic isn't a diagnosis as such, it's more a term to describe the symptoms that babies display. So these symptoms tend to be they're crying and upset and appearing to be in pain, drawing their legs up. It often happens in late afternoon into the evening and sometimes into the night. It usually begins within the first couple of weeks of life and it usually concludes around 12 to 14 weeks. Sometimes there's a little bit of confusion as to what actually constitutes constipation. So constipation really is more the consistency of the stool rather than how often they go. So for example, a breastfed baby can go maybe a week and when they do go, the stool is nice and soft. However, say a bottle-fed baby or baby that's been taking solids, sometimes it can be 2 or 3 days between stools, and when they do go, it is hard and pebbly. So in that case, that's what we call constipation. So with the strokes with the tummy, just like the general massage, it's good just to gather together all the things you need before you start. So your oil, it's also handy to have some wipes and a spare nappy, because sometimes the massage will result in them having a dirty nappy, and sometimes they'll even pass urine. Make sure your area is nice and warm for them. And just gather together everything. So once you start massaging, you can just move through the massage without disruption. So the first thing before you do start the massage is just to place your hands on them and let them know that you're going to give them some massage and you're going to help to relieve that discomfort for them. You put some oil on your hands and you rub that oil together between your hands, making your hands nice and warm. And the first thing you do is just place your hands on their tummy. So your nice warm hand on their tummy can be nice and relaxing. Just stay with them for a little moment, just connect with them, talk to them and let them know what you're doing. And the first stroke is just basically paddling down. So you're lining your hand up around the level of the belly button and then you're just scooping down. So bring one hand in after another. The next stroke after that is what we call the lowercase n. So it's like drawing the little letter n across their tummy. So starting low in the groin, you draw a line up to about the level of the belly button with one hand, with your left hand. Then with your right hand, follow that same line. Then you go across the middle at the level of the belly button or a little bit above and down the other side. So coming up, moving across and down. So if you can imagine, that's the level of the large intestine. So you're just moving things through the intestine. So to demonstrate on the doll, starting in the groin, you're coming up one side, up again with the other hand, straight across the middle, and you're dropping down. You're coming up, straight across and down. The next one is just having your hands either side of their little hips and then your thumbs fall in the middle of the tummy. The hips to the side, thumbs in the middle, and you're just stroking out. So it's a sideward stroke on their tummy. So So again, if you can imagine, if there's little pockets of wind in there, you're just helping to break them up and move them along. So just gently working across the tummy. And then the last one you can do is just with your pads of your fingers, you're walking across the tummy. So starting on the left side, it's almost like playing the piano. You're just moving your fingers, walking them across the tummy from left to right. Again, it's just breaking up any pockets of wind and helping things move through the intestine. And then you'd finish up just placing your hand back on your tummy. So you can do that when you're doing your general massage routine, or you can do that separate from your routine. The other thing you can do is to combine some of those strokes into a little sequence, or a little colic sequence, which you can use several times during the day. So based on the strokes, how the colic sequence works is you would start off just resting your hand on the tummy, as you did at the beginning. And this time you're doing everything to the count of 6. So you're scooping down to the count of 6. So 1, 2, 3, 4, 5, 6. You're giving their legs a little shake and you're bringing it in to the count of 6. So 1, 2, 3, 4, 5, 6. Bringing their little legs down and doing that little lowercase n, so coming up from the groin to the belly button, across the centre and down. And you do that for the count of 6. So that's 2, 3, 4. And you can be relatively firm on the tummy. 5, 6. And then bringing those little legs back in, again for the count of 6. So 1, 2, 3, 4, 5, 6. And then just gently bouncing those legs down. And the whole time you're doing those strokes, you'll be just checking in with your baby just to make sure that they're coping with it and that they're doing okay. So that little sequence you can repeat 2 or 3 times during the day. There are variations on those strokes, and there are other things that you can do to help move the wind through their tummy. So certainly, as we've done, bringing the legs in and out, but you can do that in more of a marching manner, so one leg in after the other, or you can do it bicycling, so a little bit faster. The other thing you can try is bringing the knees in and then just gently circling around. So it's almost like they're massaging the tummy with their legs. Just circling around just gently. Now this stroke you would just be a little bit cautious of if your baby had any hip problems, and you just want to check with the doctor before you did this one, if there was any concerns. And one other little one you can try is like the mini plow. So the plow is a yoga pose. So little mini plow, similar position, you bring the feet up and then down. And the feet extended, with their legs extended, bring them up and then down. Now with this stroke, and in fact with any of the strokes, you would never push against any resistance. So if your baby was tense and was resisting, don't push. You might want to give their legs a little bit of a juggle and maybe talk to them. And that might calm them enough and relax them enough to be able to do it, but you certainly wouldn't push them into that position if they were resisting. So there are just a couple of other little strokes or positions that you can try just to add in to the routine. There are a couple of other positions that are worth trying as well, and one's called the tiger in the tree pose, and that's basically having your baby just across your arm, almost just tucked into the crook of the elbow there. So you've got them well supported between their legs and your hand on their tummy. So you're putting a little bit of pressure and warmth on their tummy, which is really good when they do have tummy pain. You've got your other hand free to give their back a little bit of a rub. And this pose is best done standing. So standing up, and then you can be just gently rocking and moving. This is a really relaxing and comforting position for them. Having looking down and turning away, that can certainly help decrease the stimulation, and often babies are overstimulated, they do cry a lot. So this just brings everything down and just decreases the stimulation, and also you're having them nice and close and they feel comforted. It's a really lovely position to try. Another one you can try is up over your shoulder. Now this is a pretty classical position, having your baby in the upright position over your shoulder, but you can bring it up a little bit higher. So basically their tummy is tucked in onto your shoulder. So again, you've got that pressure on the tummy, and from this position you can be rubbing their back and talking to them and comforting them this way. One other position that's worth trying is over your lap. So having your legs outstretched, bring your baby down onto your lap, making sure their face is clear of your legs, having them nice and supported, and then just you're gently bouncing them on your legs. Just a gentle rock or gentle bounce. Now what that does is, again, you're putting pressure on the tummy, which can be very relaxing for them, and also the movement can help with the movement of the wind. And into this you can just add some gentle tapping. It's almost like the beating of your heart, just nice and rhythmical. And from this position, bring them up close to you and give them a big hug and a cuddle. So at the end of any massage, it's nice to bring your baby in close to you and cuddle them and hug them and reassure them. Let them know that they did a good job, and hopefully they'll be a little bit more settled as a result of their massage. Now, while it's important to calm, soothe and settle your baby, and hopefully you have a few techniques now that you can use, it's also really important, if you have a crying and unsettled baby, is to take a little bit of time for yourself, just for some self-care. So a couple of really important points that I want to share with you and for you to think about. So first of all, and probably really importantly, you must remember that your baby's crying is not your fault. Babies cry, they cry because they're trying to communicate things to you, but they cry also because they have problems as a result of things like wind and colic and reflux, which are things that are beyond your control. So while it's frustrating and sometimes soul destroying when your baby is crying endlessly and that you feel like there's nothing you can do to settle them, it's not your fault. You're doing the very best you can under difficult circumstances. Tied in with that, it's really important to know and to be reassured that this isn't forever. Babies that have wind and colic and constipation and reflux, these things tend to occur early on in the baby's life as they're transitioning into getting used to having food in their tummy, or certainly starting off with milk in their tummy and then food. And as their gut matures, these symptoms will start to settle down. So just to be reassured and to know that while it's difficult at the moment, it's not forever. Your babies will settle and these symptoms will pass. The other important thing I think to think and consider is to ask for help. Now, I'm sure you all heard of the saying, it takes a village to raise a child, and there's so much validity in that. It can be really difficult being a parent, and extra difficult if you've got an unsettled baby. So really important that you seek out help in your community, so whether that's with your mum's group or your family or extended family or friends, wherever it is you can get that help and support is really important. So just take the time to seek out like-minded people and gather together your little tribe of people around you to get the support and the help you need. So thank you for watching. Hopefully you picked up a few tips and techniques on how to calm, soothe and settle your baby. Massage is such a lovely way to connect with your infant, and I really encourage you to take some time in your day just to incorporate a bit of massage. So certainly incorporating the strokes we talked about today, but also to learn some other techniques and other strokes that you can use during the day with your baby. So thank you for watching, and just enjoy and love this time you have with your bub.